So I think science is great, but saying you like something and then doing something about it are two completely different things. And with approaching scientific research, I went through those two phases. I first became interested in science when I was younger. I was receiving a titanium prosthesis to restore my hearing. And my mum was quite worried. She was like, oh no, what's going to happen? But I thought it was really cool because I thought the technology behind it was remarkable, how this device could replace the bones in my ear and conduct sound so I could hear again. And this is what catalyzed my love with science, but I actually only got into research a few years ago when I fractured my pelvis. I fractured it twice in 3 months, and I was just running, so I'm just a really clumsy person. But I used to play a lot of squash, and I still do play squash, but obviously trying to play squash with a fractured pelvis isn't the easiest of tasks. So I had all this free time on my hand because I used to play 3 or 4 days a week. And it was frustrating. I couldn't play anymore. But it did mean that with all this free time, I could explore things I didn't have the opportunity to do so before. And scientific research was one of those things. And my first ever research project was on chelation therapy. It's used to treat metal poisoning, but it has a lot of side effects, which stops it from being used to treat other diseases. And my first project was really straightforward. It was looking at why chelating agents were causing these side effects in the hopes of letting researchers develop better chelating agents that could be used to treat other diseases like Alzheimer's disease and cancer. And it might sound complicated, but it was a really straightforward project from a scientific basis. I was just looking at enzyme inhibition. And that worked really well. But what I think was more significant about this piece of research was it highlighted science isn't what like we're taught at school. It's not about learning something and memorizing it, because no one's ever done anything by reciting the same fact 100 times over. What is really good about science is you take existing pieces of knowledge and then you apply it in a different setting, and that's where new discoveries come. And I wanted to explore Alzheimer's disease next, and at the end of my research, this is what my thing looked like. And it won't make a lot of sense now, but hopefully at the end it will. Alzheimer's disease affects over 47 million people worldwide, and it costed society $604 billion in 2010. And this disease is notorious for the fact that there exist no drugs to stop or even slow down the progression of this disease. And only 45% of patients receive a diagnosis within their lifetime. The other 55% are post-mortem, or the diagnosis never actually happens. And the fight against any disease, an early diagnosis is essential to ensure that the patient has a better prognosis. And I wanted to find a way to diagnose the disease earlier. And I looked at a family of proteins called the amyloid beta family. And the family occurs in a cyclical process. There are amyloid beta monomers, which aggregate to form amyloid beta oligomers, which aggregate to form amyloid beta fibrils, which aggregate to form amyloid beta plaques. And the gold standard for diagnosis is looking at these amyloid beta plaques. And they're the biggest structure, they're the easiest to look at. But relatively recent research has suggested they're not the best biomarker for the disease because they're present in Alzheimer's patients, but research has also found that they're present in cognitively healthy individuals. So if you're trying to diagnose a disease, having a protein that's present in patients and non-patients is going to be detrimental. But also, if you look at that cycle, those plaques are right at the end of that cycle. So by the time you see those plaques, significant neural death is going to have occurred anyway. And the thing about the brain is neural death is irreversible at the moment, and stem cell therapy is going to change that in the future, but as of right now, if you want to ensure that the patient has a better prognosis, you want to diagnose the disease as early as possible. So with an early diagnosis, it would make sense to look at the monomers. They're also right at the beginning of that amyloid cycle, but they're also present in cognitively healthy individuals, again, not making them a great biomarker. Oligomers are what I looked at. Oligomers, I think they're great because they're present in significantly higher concentrations in the brain of Alzheimer's patients. We believe them to be the most toxic form of amyloid beta, but they're also present up to a decade before symptoms first start to show. So if you're targeting this protein, you have a massive head start in ensuring the patient receives a proper diagnosis and their prognosis is favorable. But amyloid beta oligomers, they're still part of that amyloid family, and antibodies are specific to proteins, one particular protein. Amyloid beta is one type of protein. These oligomers, monomers, fibrils, and plaques, they're just the same protein, just clumped up, so it's difficult to just target one species of amyloid beta. But that being said, antibodies have a slight preference to one species over another. And I was able to design an antibody that's specific just to those oligomers. Well, I mean, that's not necessarily true. There's always going to be some cross-reactivity with antibodies, but this was more specific than existing antibodies to amyloid beta oligomers alone. It turns out that wouldn't work, because if you want to treat a disease of the brain, it's useful if the drug gets into the brain in the first place. And antibodies can't do that. They're far too big to cross the blood-brain barrier. And to overcome this, I use a technique called receptor-mediated transcytosis. The blood-brain barrier stops 99% of all drugs developed to treat the brain from getting into the brain. And to overcome this, doctors and researchers inject drugs into the spine to bypass that barrier. But as you can imagine, that's extremely painful, uncomfortable, and takes a while. So using receptor-mediated transcytosis, the antibody complex is able to enter the brain, and it works like this. Imagine if you have the barrier in front of you and a receptor at one end of the barrier. If an antibody binds strongly to that receptor, it's going to bind, cross the barrier, but because it's bound strongly, it will stay stuck on the other end. If the binding strength is too weak, it won't engage the receptor in the first place. But if the binding strength is within certain values, it will bind, cross the barrier, but because the binding strength isn't too strong, it will be let go on the other side. So now I need an antibody with a specific binding affinity that falls between two particular values. And this would require another antibody. Antibodies have different subclasses. So if you've seen an antibody, 9 times out of 10, you've probably seen an IgG antibody, which is like your Y-shaped antibody. Those have a very strong affinity. And I use those antibodies to target amyloid beta oligomers because I want an antibody with a strong binding strength to bind to those. If I want to target transferrin receptors to get into the brain, I need an antibody with a weaker binding strength. And there's a subclass of antibodies called IgM. And they're arranged in a pentagonal structure with Y-like projections at each point. They've got a high avidity because there are so many binding sites. So overall, they've got a really good binding strength. But if you break them down to each individual binding site, their individual binding is quite weak. And I have 2 antibodies. I need both their properties in one single antibody. So the answer was just to fuse them together. I broke the antibodies into small fragments and then joined those fragments together to create a bispecific antibody, one antibody with 2 different targets. That was cool, but that also didn't work on its own, because now I've created this antibody, I have to see it somehow. And to overcome this, I use a nanoparticle called a quantum dot. If you grow them at the right size, they can emit light in the near-infrared region, and that's beneficial, but the near-infrared only has a penetration depth of a few millimeters. And if you're thinking in context of the brain, the cranium is going to absorb a lot of that emission anyway. So to overcome this, I designed a new nanoparticle that had near-infrared as well as MRI imaging capability. By chelating gadolinium to the surface of the existing quantum dot and then wrapping a shell of silica around it, it reduces the toxicity of the quantum dot and improves the optical properties. So now you have 2 ways of imaging the same quantum dot. Then I conjugated the quantum dot to the antibody, and now I've got this complex that enters the brain, targets this toxic protein that's present in the early onset of the disease, and can be detected by MRI and near-infrared imaging. And that worked quite well. And so I entered my research, and so this is the MRI aspect. If you look at the white bit, that's the gadolinium showing up on the contrast. The phosphate buffer saline and the non-chelated quantum dot don't show up that well on an MRI scan. And this shows it's working. But the most interesting part of my project was something I wasn't expecting at all. I was creating something that was meant for the earlier diagnosis of the disease, and that worked pretty well. The fact that you can see it here is evidence of that. But the antibody was exhibiting some sort of therapeutic effect. These oligomers, one of the reasons they're so toxic is that they're very soluble, so they're readily able to enter cells. And when they do that, they cause cellular havoc. But when the antibody is binding to these oligomers, the oligomers are made insoluble, so they can't enter cells. And if there's fewer toxic protein in cells, fewer cells are going to die. On the image furthest to that side, the red stuff are the toxic oligomers. And the side closest to me, you can see there's a significant decrease in the amount of red. And that shows there's a significantly less amount of amyloid beta oligomers. And I think what's interesting about it is it's not interfering with the diagnosis. You might think if you're getting rid of the oligomers, how can you use it for diagnosis? Because there are fewer oligomers than you started off with. But it's not actually getting rid of them. They're there, they're just locked up so they can't do anything, and then the body clears it away naturally. And I was really proud of that, the results, and I entered into competition. So I entered into the Google Science Fair, in which I became one of the award winners, and it was a really, really cool competition. We got to go to California, to Googleplex in Mountain View, and we got to meet loads of other incredible scientists from around the world doing some great things. And the atmosphere was very collaborative. And I think what the coolest thing was, before the award ceremony, there was a party, and to that party, the co-founder of Google turned up, and no one was expecting it. So it's always nice to say we got to party with the founder of Google. But what was most frustrating about the research wasn't the theory, or it wasn't the actual experimentation process. It was about getting started. I emailed 54 different labs before I got one positive response, and that was only 3 months after I first emailed them. And this was very frustrating. I think it's this notion that deters a lot of us as students from pursuing scientific research. I can see where they're coming from. I mean, if you get an email from a 15-year-old asking for access to toxic chemicals and expensive equipment, it does tend to make people uneasy. I mean, I told them I'd fractured my pelvis just running. I think that could have put them off as well. But science, I think, it's not about how old you are. It's just about having ideas. As long as you have an idea, you have something you could work on. And I believe that us, as students, do have the potential to change the world. There are 1.2 billion teenagers in the world between the ages of 10 to 19. That's 1.2 billion minds full of curiosity and potentially world-changing ideas. And a lot of those ideas remain just that, ideas, because most of the time we don't do anything to pursue them. But in a world that's so connected and interdependent, we can't give the excuse anymore we don't have the resources to do so, because we do. We just have to go out there and get them. I mean, it'll be difficult to do, of course, but you still do have the resources if you try hard enough. But if even just a fraction of that 1.2 billion, even just 1%, that's 12 million ideas coming to life. And with 12 million new ideas, imagine how much we could progress and how much us as students could change the world. I mean, all we have to do is just go out there and get started. Thank you.